We can also use it, like we talked about, as a predictive tool. So this is another study by Smith and colleagues. They took 52 patients with, again, previously undiagnosed lower respiratory symptoms, and they completed some baseline testing. And then they started a 4-week trial of inhaled corticosteroids. And then the patients that responded to them, they looked at who would respond and who didn't. And a steroid response to ICS was considered in patients who had improvements in their symptoms, peak flows, spirometry, or airway hyperresponsiveness. And they found that patients that had an ENO over 47 were very likely to respond to inhaled corticosteroids. And so they said the predictive accuracy of ENO to identify steroid responsiveness is a lot greater, and it was more predictive actually than using the FEV1. And so this study, in addition to other studies, led to the American Thoracic Society putting out a statement saying that fractional exhaled nitric oxide has been shown to predict the likelihood of steroid responsiveness more consistently than spirometry, bronchodilator response, peak flow variation, or airway hyperresponsiveness to methylcholine. And although this is in the context of speaking about asthma, clinically we can use this in other scenarios as well. So patients do come in with things like chronic cough and other lower airway symptoms, and if they have normal spirometry, an ENO level that's elevated is very likely to respond to inhaled corticosteroids. So not exactly asthma, but still likely to respond if you start a steroid medication.